Hi guys, welcome. I feel like y'all might be tired of my kaba, but this is the last. Well, I think it's the last thing we're gonna talk about when it comes to just your body and how it works and things that can go wrong. So I would like to talk about cancer of the larynx. First, what is the larynx? The larynx is like a part of your like upper area where it is used, for your voice, like, to talk, for like sound. So what happens is, let's talk about like some of the risk factors first. What is it caused by? What causes it is squamous cell carcinoma, something called squamous cell carcinoma. Yeah, so if you like happen to like scream a lot, you yell a lot, you sing, you're a musician, if you work in like, or you drink a lot of alcohol, think about that erosion and that irritation. If you happen to smoke, or you live around, or tobacco, if you live around people who work with cement, air pollution, you're prone to having cancer of the larynx. So those are the risk factors. And if you're a male too, and over the age of like 50, over the age of 50. So it has many classifications. Like I said, we're going into details with this. It has the supraglottic, glottic, and subglottic. The glottic being the most the glottic is the one that is the most like that most people have, followed by the supraglottic, and then the subglottic, epiglottis, glottic area. So a lot of the times this cancer is not really like noticed, because like, people might think it's just, they just had a pharyngitis, like a little hoarseness, just like that. But early signs is like hoarseness greater than 2 weeks, persistent cough, like, and a sore throat. You see how that could be confused with like pharyngitis. But then like when they keep having it and then it gets worse, it goes all the way down to like you not being able to swallow, like what they call dysphagia. You no that's yeah dysphagia, not being able to eat. Like it becomes so bad, and then because of that, sometimes these people, like, they wouldn't want to eat a lot because it hurts, so it's painful, and they have really bad breath because of the tumor, think about it, in the throat. So those are the late sign. The hoarseness is early sign, but like the foul breath, trouble swallowing, sometimes even difficulty breathing. We talked about obstruction earlier, due to the inflammation in the airways. So so trouble swallowing, having foul breath, and difficulty breathing are like the late signs of cancer of the larynx. And then so that's really that. And then some of the treatments that they have is like radiation, just like any cancer. If it's small, they'll do radiation, or they can do chemo, but recurrence is really high. So the best thing that they say to do is then I was confusing cancer of the pancreas. Damn, I have another video to make. Excuse me. So this one, you can fix it. Like surgery is actually the best thing for this. Surgery can really help. And then we can talk about the diagnostic. So in order to actually find out if you have this, they can do a direct laryngoscope, right? Where a laryngoscope directly, so it's not done like at the bedside. You might go in for surgery and they'll sedate you completely. And then they can do an indirect where that is done at the bedside, where they just go in and look. So the direct is like the really one that you go for the surgeon, and the indirect is you do it at the bedside. But we'll find out that you have it based on your reports. Like if you've been reporting like, oh, my throat hurts, it's been hurting for the past 2 weeks, and now it hurts so bad that I can't swallow, I can't eat, and I've lost like 20 pounds in the last month. So we'll look at that. So they can also do like MRI or CT scan. And it's important to also know, I didn't know this, but how to stage the cancer. They use something called a TMS, which is tumor node metastasis. So just understanding, first of all, when they say stage 1, stage 2, stage 3, stage 4. Stage 1 is when it's actually just like really tiny like this, right? That is stage 1, but it's there and it's just in one space. Stage 2 is when it has grown a little bigger, but it's still in the same place. Stage 3 is when it has gone to a lymph node, and stage 4 is when it has gone to a lymph node and it has gone to another organ. So with the TMN, we do tumor, how many tumors are there, how many nodes are there, and has it metastasized. And so we said surgery is the best for this, and there are many types of surgery. There is vocal cord stripping, where they'll just scrape the lining of your vocal area, try to remove that bad air, that little, like the mucosal area. They can do a chordectomy, where they remove one of the vocal cords. They can do a laser surgery, where they come in with laser and try to strip wherever the cancer is at. And they can do a partial laryngectomy or a total laryngectomy. A partial laryngectomy is like, okay, like they'll remove some of the larynx, but not all, but you're still able to talk, you're still able to eat. The only thing with this is that you might be a high chance of getting an obstruction in the future. I guess maybe I should have started with this before talking about airway obstruction. Yeah, so your speech is still there, but the total laryngectomy is when they remove the whole larynx, right? The whole thing, part of the tongue. Is very like invasive. You're like part of the epiglottis, the tongue, and the trachea. Whoa, the epiglottis, which helps like stop food from going there. The trachea, which is your airway, and the tongue, which helps you speak. So think about it. So all of the sound is gone. So when we think about this, like a person who has this condition, we're thinking, what could they be thinking? Like, how are they feeling? Like when I think to myself, I'm like, if I have this, how would I be? So first of all, you have body image. Like you're going to be like, well, what are these people going to think if they see this little hole on my neck? Because again, they will need an airway if they're taking out the trachea. But the first is like, the most important problem is gas exchange, because you're not breathing in from up here anymore, you're breathing from here. So you will need humidification, you will need impaired gas exchange you have. And what's another problem? And then your speech, you won't be able to talk. And we'll talk about like ways, and even infection is very common with anything that bypasses the nose. So the way we can take care of the speech problem is there's like this artificial speech like that they put out externally. It's really not that good and they sound like a robot. Or they can actually come in and do a fistula and put in I always forget the name of this thing, a TEP prosthesis. So they can put in a TEP prosthesis in there, a TEP prosthesis. This is way better because it sounds a lot more like our natural voice. So they'll kind of like push it, or initially they can do something called an esophageal speech, where they would kind of breathe in the air and take it up and use that air to kind of talk. But I mean, that's kind of hard to do, so they'll rather stick with the TEP prosthesis. So infection, again, we just want to make sure that we come in or suction or whatever, do things in a sterile manner. Watch out, tell them, we need to watch out that these people don't have a fever, and watch out the white blood cell count, and they have to take it very seriously if they get a fever or if they're sick. With body image, there's really nothing we can do but like just have them, or like with anything in life, if you cannot do something about something, it helps to talk about it, and eventually you learn to live with it and put it in the past. Yeah, so that is really that for cancer of the larynx. The other thing I was going to add that I didn't talk about earlier is just this thing with the mechanical vents that as a result that can happen as a result of a mechanical vent or an infection. It's called ARDS, which is the problem with your lungs. There's something that happened, infection of the alveoli, and then the alveoli collapse. Alveoli is where gas exchange happen in your lungs, like where you breathe your lungs. So if the collapse of your alveoli, there's not enough oxygen going in, and because of the collapse of the alveoli, there's something called refractory hypoxemia, where because the alveoli collapse, obviously there's no gas exchange happening. So alveoli collapse, impaired gas exchange, therefore refractive hypoxemia, decreased lung expansion. So your lung is not able to expand and relax due to the alveoli collapse, and there's also decreased surfactant. Treatment for this is we might give, again with this, because it's usually as a result of using the vents, we'll give them histamine, we'll give them corticosteroids for the inflammation, histamine like the tidine, like corticosteroids like the medication ending in zone to decrease that inflammation. What else might we give them? Again, just be watching our vitals. O2 stat, give them oxygen, definitely give them oxygen even though it is not going through. And vasopressors, just to kind of press that oxygen to the rest of the body. And if it's caused by a bacteria, we're going to give antibiotic. I hope that's it for for the body. I hope that's it. And I'm going to move into talking about our psychology. And I don't know, I'm not too good with this because it's kind of very vague. I just hope that whatever I know is enough for my life or for everything I need to know. But yeah, it's just okay. All right, thank you for watching my video. I hope you liked this video and that it was very informative. I will make another one today. I see you in my next video. We'll talk about psych and just life and how to communicate. At least try to implement that in your daily communication, and it will really be effective, or it will help you with your interactions with other people. Thank you for watching my video. Bye.